Hello, I'm Thomas Knopp. I'm a gastroenterologist here at CSGA in Lexington, Kentucky. And we're here today to talk to you about colorectal cancer awareness. March is Colon Cancer Awareness Month. Colon cancer is the second leading cause of cancer-related death in the United States for both men and women. This cancer is largely preventable with high-quality screening examinations. Despite this fact, only 50% of those in the state of Kentucky that are eligible for screening are getting in for screening examinations. This is unacceptable in our eyes. We need to stop this cancer from killing our friends, family members, people in our communities. So here at CSGA, we've chosen to put together a few short video clips to try and reach out to the public and increase awareness. Today, we are extremely lucky to have a great friend of mine, John Weece, the lead pastor of Southland Christian Church, come to talk to us about the emotional, psychological, and economical strain that the diagnosis of colorectal cancer places on a patient and their family.
Yeah, it's interesting. I think after you do your work in the office and give the diagnosis to a patient, they're then left to get in the car and kind of pick up the pieces, go home and explain to family members and coworkers what they're facing. And on my end of things, I always encourage people to have a secondary person that they can go and talk to. And I just call it the 5 E's. And I think it's important to have one other person that you can go first to and express, man, I'm shocked, I'm sad, I'm scared, even I feel lonely or maybe even a little depressed at this diagnosis, before they then go explain to family members and coworkers. And I think it's important that they understand how those people are going to react and how they're going to respond, because it's a shock to them as well sometimes. And especially for little kids, a lot of resources out there available for kids to be able to understand that, man, cancer is not always a life-ending diagnosis, that, as you said, with good screening and good treatment, that their loved one's going to continue to be around. And then I encourage those people to take out the next 4 E's, which is help that person be educated, help them exercise, help them eat right, help them enjoy life while they're going through this tough time. They're just going to need that support emotionally.
And it's great as physicians. We're so focused on the medical aspects of cancer management, or the surgical aspects of cancer management. Making the diagnosis, setting up the surgery, getting the appointments lined up. It's a lot of times we feel like our job's been completed at that point in time, and we move on to the next patient that has a problem that needs to be addressed. We don't always realize, and we probably should realize, that patient that we've just given this life-altering diagnosis to now has to go home. They have to rejoin their family members with this element of shock. They've got to try to find out how they're going to get back to work. Worry whether they're going to be around for their kids.
Sure.
How does one deal with that? Where do they start?
Yeah, I think it's important for you as a physician just to say, the golden rule: treat others as you want to be treated. If you're in their seat, how would you want this to be communicated? And I think most doctors do a great job at that. I think you guys don't give yourself enough credit, but I do think it's important for you to say, I'm available even after hours if you have questions, or if I can talk to your family members if you want to bring them to your next appointment, because most people just have a lot of questions, and those questions that go unanswered are typically the ones that bring up all kinds of raw emotion in folks, and they just don't know where to turn with those things. So they get online and they get bad information, or they hear from another friend who said, well, my family member died within 6 months, and it sets off all kinds of alarms and bells and whistles. So I think it's important for you just to say, I'm here, I'm giving you a diagnosis today, but I'm going to be with you every step of this way. And that just reassures everyone. And having had several family members in my life, have to deal with cancer and go through the treatment and even the fatigue of that, it was so wonderful to have doctors who even just put their hand on my dad and said, hey, you're going to make it and everything's going to be okay. And for us, that was just like, he's the professional, and we're trusting him. Not that you're a miracle worker, but I think it's really reassuring emotionally for people, because there are financial ramifications and occupational ramifications that just really scare people.
Well, our community is extremely lucky to have not only great medical professionals, but also great spiritual leaders, great folks in the communities that are able to offer support. People like John and those at his church. These are very important tools for patients to utilize when they get a diagnosis such as colorectal cancer. And we're lucky to have them at our disposal. However, this disease is preventable. It's preventable with high-quality screening. You do not have to bear this struggle. Yeah. So please, educate yourselves, educate your church members, educate your community members, educate your family and friends. If you're over 50 years of age, get in and get screened for colorectal cancer. Let's put an end to this awful disease once and for all. Join CSGA on March 4th by wearing blue in support of colorectal cancer, and also join us on March 12th in conjunction with Habitat for Humanity. We take part in the Shamrock Shuffle.